Hello everyone, I'm Dr. Samriti and today we will discuss in the ongoing series of Basics of Biomechanics about the topics Behavior of bone under load, its clinical applications and failure criteria of bone. So let's start with our session. So first of all, what is a load deformation curve? Although we have already studied this, but to know the behavior of bone under load and to know how bone strength varies with load, we need to study load deformation curve very effectively. So when we all know that when we apply a load, the bone will undergo a deformation. Okay, so this load deformation curve will provide us with the information about the strength properties of the bone. So let's start with this curve. First of all, the point A to point B shows the elastic region of the bone. So what is the elastic region? In any elastic region, if suppose if A to B is the elastic region of bone and we apply any load to the bone till its elastic region, that is from point A to point B, the any deformation that will occur in this region will not be permanent. It will not be permanent. It will return to its original configuration as soon as the load is removed. So that's why it is known as elastic region, because in this region the bone shows the property of elasticity and undergoes deformation due to loading but come back to its original configuration as soon as the load is removed. Okay, so after point B, so now what is point B? Point B is the yield point, that is at the end of elastic region. The material that will go under loading beyond this yield point will no longer immediately return to its original state when the load is removed. Although it may recover in time. It may recover in time, but it will not immediately return to its original state when the load is removed. So that's the difference between the elastic region and the plastic region, or the properties of elasticity and plasticity of the bone. So from point B till point C is the plastic region of the bone. Although the structure will appear to be normal, intact, but after the load is removed in the range of plastic region, the material or the bone will never recover to its original length. Any deformation that will occur in plastic region will be permanent. Okay, so this is the difference between elastic and plastic behavior that a bone shows during loading mechanism. So if loading continues in plastic region, what happens is the bone may get damaged, it may get damaged, but most of the times the load is taken away by ligaments and muscles. So ligament strain and muscle strain are more common before bone gets into failure. So if any load applied in the plastic region, that may show that the recovery of original structure probably could only occur through the synthesis and reorganization of the new tissue components. Okay, so let's take an example of ligament sprain. अगर ligament sprain होता है तो उसमें कुछ कुछ हमारे जो ligament tissues हैं वो worn out हो जाते हैं, डैमेज हो जाते हैं, तो वो तो worn out हो गए, that deformation is permanent, but we have to heal that. तो हमारी जो भी हम प्रोसीजर्स करते हैं या जो भी हमारा फिजियोथेरेपिटिक ट्रीटमेंट रहता है या अदर जो भी मेडिसिनल ट्रीटमेंट होता है, तो उससे क्या होता है विद इन टाइम बीइंग जो टिश्यूज हैं वो रीऑर्गेनाइज और सिंथेसाइज करते हैं खुद को और एक न्यू टिश्यू कंपोनेंट बनाते हैं. ठीक है, सो दैट इज द ओनली वी कैन से दैट दैट्स द वे to recover. That's the body's way to recover itself or recover its original structure. Okay, so this was just an example of ligament sprain. So see, if load continues through the plastic region and reaches at the point C. So what is the point C? The point C is the ultimate failure point of the bone. Okay, so if deformation goes on occur and we are going on to applied load, the at the point C, when the load is applied, it will lead to the failure of the bone. It may cause fracture, microfracture, anything, but it will lead to the failure of the bone under loading. Okay, so any load that is being applied at this point, this ultimate failure point, we can say that that load is a failure load, because after that application of load, the bone or the tissue will undergo this failure. Okay, so let's summarize this load deformation curve. So from A to B, it's elastic region. B is the yield point, that is the point from which, if the after which point the load is, if the load is applied, the bone will never recover to its original configurations. It There may be some deformation. You can say that some deformation will be there that will stay there permanently. So if the load is applied within the region of A to B, any deformation that will occur will recover immediately after the removal of the load. But after the point B, there will the deformation will remain throughout. Deformation will remain throughout, because now the bone has reached its plasticity level. Okay, so after the point C, that means the ultimate failure point, the bone will continue to deform till point C of the plastic region. But at the point C, if we apply any load, it will apply any load force, the bone will ultimately gets into fracture or failure. That is the ultimate failure point. So this is how bone behaves under load. Okay, so if firstly it will show elastic properties, that is, and then it will show its plastic properties, and ultimately it reaches to its failure point. So this is all about how a bone behaves under load. Okay, so clear for all. Moving on to the next slide. So now, what are the clinical applications of loading? So अब हमने ये तो पढ़ लिया कि बोन, अगर बोन पे कोई लोड अप्लाई करेंगे तो बोन विल गेट डिफॉर्म फॉर दिस पॉइंट, for a particular region it will show elastic behavior, then for after that threshold it will show plasticity behavior, and then it will go ultimately to the failure point. We have discussed this earlier, but what is the logic behind that? Why are we studying? If the load is being applied to the bone, it is being applied. What is the need of studying that? Okay, so there must be some clinical correlation, na? That's why we are studying the loading behavior of the bone. So let's discuss those clinical applications. So first of all, we all know that the bone exhibits anisotropic behavior during loading. So what is anisotropic behavior? That means that the direction and size of the load applied will affect the behavior of bone under load. Okay, so mechanical properties of bone will change depending upon the size, or we can say the magnitude of force, as well as depending upon the direction in which the force is applied. Okay, so we have taken an example here, that the red color shows the longitudinal loading of the bone, blue color shows the loading of the bone at 30-degree angle, yellow shows that the bone is being loaded at 60-degree of angle, and pink or maybe purple color shows that the bone is being loaded transversely. So what is the logic behind that? Why we should study that? Load is 5 kg. Suppose we are applying 5 kg load to this one. So magnitude is same. Okay, 5 kg load is applied either at 30 degree, either at 60 degree, or longitudinally or transverse. Why we need to study this? Because if the angle changes, the bone will change its behavior towards that force. Okay, so we can clearly see in this stress strain curve that when the, let's compare the longitudinal and transverse process. When the transverse loading is applied, okay, the bone shows deformation, but it reaches its ultimate failure point very earlier, very much earlier. Okay, very we can say that is time from being loaded and to reach its failure point is very low while the bone is loaded transversely. But if compared with the red line, the longitudinal loading behavior, when the longitudinally the load is applied to the bone shows the elastic behavior, then shows its plastic behavior, that is before reaching its ultimate failure point, the bone is deforming very much and then it goes to its failure point. Okay, so we can say that if we apply the we apply the load longitudinally, then the bone will reach its failure point very much after deforming. Okay, but if we concern the transverse loading, in transverse loading the bone will reach its maximum or ultimate failure point before getting that much deformed. Okay, so that's why we here need to study about the anisotropic behavior of the bone. So this is the clinical application, that when we are applying loading, suppose what kind of loading we apply to the patient. We give patients traction. Okay, we give section, compression, and traction forces to the patient while treating any condition. So when we apply the loading or our force in longitudinal direction, the bone or the tissues that will undergo that loading will show much more deformation before getting into its failure point as compared at different angles, and very less deformation at the transverse level, transverse loading. Okay, so that's why we have to study this anisotropic behavior of the bone. So all clear with this, that a bone if loaded longitudinally will show more better plasticity before going into the failure, and if the angle goes on reducing from 90 degree, same as the failure point will so the failure point we will reach the failure point very early as the angles go from decreasing. Okay, so this is about the anisotropic behavior or behavior of bone under loading in different directions. Okay, so moving on to the next slide. So now hysteresis. So we all have experienced that, or we have also studied in our 12th physics, that when we check the force and length of tissue during loading or during load deformation that may occur, so we'll see that the resulting load deformation curve will not follow the same path. That is, the path that is followed by the structure during loaded will be different from the path that the bone will follow during unloading. So why this is? Because if we are applying 5 kg load and we are removing 5 kg of load, then loading and unloading lines should be same, na? But this is not what we practically see. So why this is not same? Because all of the energy gained as a result of lengthening work. Okay, so suppose we are stretching, तो जितनी हमने lengthening करी मसल की, ठीक है, तो जितनी भी उस टाइम पे एनर्जी चेंज हुई, एनर्जी एक्सचेंज हुई, वो सारी की सारी एनर्जी जब हम वो स्ट्रेच रिमूव करेंगे वो कन्वर्ट नहीं होगी, वो सेव नहीं होगी. सम ऑफ दैट एनर्जी, सम पार्ट ऑफ दैट एनर्जी may be lost as heat. Okay, so that's why when we draw a hysteresis curve of loading and unloading any part of the bone or any part of the body, we will observe that the loading and unloading curves do not follow same path, just because the energy used in the lengthening of the tissue is not totally stored while it's getting its original position. Some of that energy is lost as the form of the heat. Okay, so this is about the hysteresis curve. Moving on to the next slide. So now, what is creep behavior of the bone? So creep is a deformation that occurs under a prolonged and sustained loading, and it can lead to the permanent damage in the bone. Okay, so in this graph, we are the x-axis is showing the time for which the load is being applied, and the y-axis is showing the strain. So when we apply the initial strain, okay, constant load, we'll apply constant load. The deformation that will occur in the bone is shown as primary creep. Now we have not now we will not apply any more load, but gradually with time, the constant load that has been applied to the part or to the bone will show or will elongate the bone further with the uh, ongoing time, or with the time being. That means the secondary creep will occur. Okay, so after the secondary creep, the tertiary creep will occur similarly. Load is constant. We are not applying load again, but under the stress of or strain of same load, the bone continues to elongate over time. Okay, so when it reaches its particular tertiary creep, it will ultimately lead to its fracture point or its failure point. Okay, so why creep is important? Because when the creep strain is goes when creep strain goes on increasing with time, it will ultimately lead to loss of stiffness and strength of the bone. That means the bone will lose its stiffness and strength with repetitive loading as a result of creep strain. So that's why we have added creep behavior here, because if we are going to test it clinically, we'll see that when we apply a load, the primary deformation will occur. But now we are not applying other load, we are maintaining that load only. Then with the time being, the tissue will elongate with the same load. That is the secondary creep that will occur, and ultimately with repetitive creeping behavior or the repetitive loading will lead to the creep strain, and that will lead to the fracture of the bone ultimately. Okay, so in simple language we can say that कि आपने एक धागा लटकाया, सपोज एक धागा लो, अब धागे से आपने कोई भी वेट लटका दिया, ठीक है, थ्रेड से कोई भी वेट लटका दिया. अब वो वेट जब लटकाया, और या फिर कोई आप वो ले लो, इलास्टिक रबर बैंड ले लो, तो आपने उस पर लोड अप्लाई करा, एक पर्टिकुलर लोड के लिए वो इतना इलोंगेट हुआ. अब आपने उसको मेंटेन रखा उस लोड को, तो तो you will see कि वो और ज़्यादा elongate हो जाएगा थोड़ा सा. But when its threshold or its failure point will reach, the failure point of the material will reach, that creeping strain will lead to its failure or fracture, और it may break that thread. Okay, so इसलिए हम बोल सकते हैं कि when we apply a constant load, it will with time will lead to the ultimate failure of the bone or may cause fracture of the bone. Okay, so this is all about the creep behavior of the bone. Moving on to the next slide. So now what is stress relaxation? Suppose when we stretch a tissue, that means if a tissue is stretched to a fixed length, the force required to maintain that length decreases over time. Okay, so when we apply strain at constant rate, the stress or straining time increases, but if we maintain that constant stretch, the stress required to maintain that particular length will decrease over time. ठीक है, ये हम सब क्लिनिकली भी देखते हैं. जैसे सपोज we are stretching any suppose we are stretching calf muscles. So when you will apply the stretch, then maintain it constant for 30 seconds. Suppose your hand will perceive as reduced resistance to the stretch. You will feel that the resistance you have felt at the beginning of the stretch will now has been decreased while you are maintaining your stretch. Okay, so that means that this stress relaxation property shows that when we apply any stress, any strain at constant rate over time, the force required to maintain the tissue length reduces. Okay, with the time being the force required to maintain the tissue length decreases. Okay, this is all about the stress relaxation. So now, what is strain rate sensitivity? Basically, we all know that all tissues behave differently when loaded rapidly or slowly. Okay, so when a load is applied rapidly to the tissue, it becomes stiffer, and a larger peak force can be applied to that tissue as compared if the load is applied slowly. Okay, so when we do faster loading of the bone, it will increase its elastic modulus, and elastic modulus tells us about the stiffness of the bone. So if elastic modulus will increase, it will lead to increase in the stiffness of the bone, and ultimately it will lead to increase in the brittleness of the bone. That means if we do rapidly loading of the bone, it will become stiffer and will take longer to reach creep failure or ultimate failure. Okay, as compared to slow loading, when we load slowly, when we apply load slowly to the bone, the creep will be earlier. The creep will occur earlier, and the bone will become less stiffer and will get easily fractured. So this is the basic difference between the fast and slow loading mechanism or the strain rate sensitivity of the bone. So we have already studied that longitudinal loading in longitudinal loading as with comparison to transverse loading, the bone proves much stronger in longitudinal loading. Similarly, the bone behaves stronger when we apply the load rapidly as compared to the slow loading. Okay, so moving on to the next slide. So now here I have given three pictures just to make you clear about how load will lead to the failure of the bone. Okay, so first of all, as we have discussed that if the load continues beyond the plastic region, the remaining collagen fibers experience great stress and rapidly rupture sequentially, okay, creating the macro failure of the tissue. So in case of ligaments and tendons, if failures occurs in middle of the structure, okay, in the middle of the structure for disruption of connective tissue fiber, it is called rupture. Okay, as shown in the anterior cruciate ligament rupture, the rupture is in the connective tissue fibers in the middle. Okay, the disruption is in the middle of the fibers, so it is known as the rupture. Okay, but if the failure occurs at the bony attachment of ligament or tendon, it is called an avulsion, as in the second picture it is clear. So first picture is showing that the any loading beyond plastic fusion firstly will lead to macro failure of the tissues, and in case of ligaments and tendons it will lead to the disruption of connective tissue fibers in the middle of the structure, that is rupture. The second picture shows that if the failure occurs at the bony attachment of ligaments or tendon, it is called as an avulsion. And when, as shown in the third picture, the failure occurs within the bone tissue, it is called as fracture. Okay, so when we apply any load to the bone will get failure or will reach its failure point at different levels before reaching to its ultimate fracture point. That means it will the firstly the soft tissues will get affected, there may occur rupture, then there may be avulsion, and finally if the load is that much high, it will lead to the fracture of the bone. So this is just to make you clear about the loading behavior of the bone. Moving on to the next slide. So now here we are showing the different properties of cortical and cancellous bone. Here we are discussing about the compressive strength, tensile strength, strain to failure percentage, fracture toughness, and Young's modulus of elasticity. Okay. So as far as compressive strength of cortical bone is concerned, we can see that it is about 230. Okay, 230 megapascals. Okay, so that means that it is as strong as cast iron. Okay, our cortical bone, the outer part of the bone that is compact and stiffer, is as strong as the cast iron itself. Okay, and if we see about the tensile strength, we see that our bone is not as strong in tension as in the compression. Okay, because the strength depends upon the density, that is mineralization, as well as orientation of the trajectory in relation to load. So because when we apply compressive forces, the trajectory arrange themselves very strongly, that's why we have more compressive strength. And while we apply tensile strength, if tensile strength is low, because of less mineralization, less density of the bone in that direction. Okay, so that's why we can say that our bone, cortical bone, is as strong as cast iron, but it is not that much strong in the tension as in the fracture, as in the compression strength. Okay, so that's why if the load is applied along the long axis of the bone, as we have already discussed, it is much stronger. Okay, so we strain to failure percentage here is given, that is cortical bone is 1 to 3 and cancellous is 5 to 7. So here we should all know that the bone works on SAID principle. Yes, SAI, SAID principle. That means specific adaptation to impose demands. Okay, whenever any connective tissues or bone is applied to load alterations, they behave depending upon the load that is applied, depending upon the magnitude of the load that is applied, depending upon the direction of load that is applied. Why? Because they work on set principle, that is specific adaptation to the imposed demand. यानी कि जो भी हमने उन पे डिमांड इम्पोज की उसको लेकर फर्स्टली दे ट्राई टू स्पेसिफिकली अडेप्ट इट्स मैकेनिकल प्रॉपर्टीज टू हम कह सकते हैं कि to not to get failure and try to combat as much load as they can. So this is the specific adaptation of all connective tissues, especially bone, that is set principle. Okay, so we all know that modulus of elasticity is the measure of material stiffness, that is its resistance to the external loads. So what can be what we can know from this Young's modulus? We can see that the cortical bone has high modulus of elasticity. That means cortical bone is very much safe and it can resist very much external. Okay, it can resist very much external loads too. Okay, similar to that of the wood. Okay, so if we talk about the compressive strength of cortical bone, it is as strong as the cast iron. But if we check about the stiffness and ability to resist the external loads of cortical bone, it behaves as a wood. Okay, it behaves as a wood. So this is all about the different properties we can clinically correlate somehow. I know this topic is kind of boring for us, but if we study these basics now, we will be very clear about the different advanced biomechanics of our body. Okay, so trying my best to make this topic as interesting as possible. So moving on to the next slide. So now, what is this picture indicating about? Osteoblasts and osteoclast activities. Okay. So whenever we apply loading and we then remove load, that is repeating process of loading and unloading on the bone activates this osteoclastic and osteoblastic activities, and these activities balance each other during the both loading and unloading processes. Okay, so as we have studied in the last session of mine, that when we apply the load in tension, इस टेंशन जो टेंशन साइड है that behaves as osteoclastic side and the compression side behaves as the osteoblastic side. Okay, so this is the main clinical correlation that is always our main concern, that is due to repetitive loading and unloading our bone formation and resorption both activities stimulate and regulate our bone growth. Okay, so this is all about this picture. So now, before starting the fracture mechanism or failure criteria of bone, we have now been clear that what is the behavior of the bone under loading and how we can clinically correlate that effect, maybe positive or negative effects of loading on the body. So it is very clear from the session till now. But now, what if our bone gets failure? Because as we have studied in our load deformation curve, that After the plastic deformation ranges, when the bone reaches its ultimate failure point C, it will get fractured or goes into failure. So what can be the mechanism, what are the criteria that will lead to the fracture of the bone? So briefly we can say that there are the 6 main mechanisms due to which our bone or our tissues got failure or goes in failure or get our bones get fractured. Okay, so these 6 are overload, buckling, impact, creep, fatigue, and wear. Okay, so we'll discuss one by one. Let's start with overload. So as it is very clear from its name, overload means our stress increases or exceeds the failure stress or load of the bone. That is, the load, or we can say that it is the failure load. Overload is the failure load that is applied even after we reach at the point C in the load deformation curve, that is the ultimate failure point. It will lead to the fracture of the bone or failure of the structure. Okay, so this is overloading. Second one is buckling. So what is buckling? Uh, Normally we came across terms that my knee buckles. Patient complains of the complains that his knee buckles out. Okay, so why this happens? When sometimes our muscular structure is not that strong. Okay, so when the muscular structures can't hold the bone in the position, and we immediately or apply a load, or we try to stand from sitting position. When we try to stand from the sitting position, ultimately we are putting some load on our lower limb. Okay, so when we apply some load, that will lead to the buckling of, because of uneven forces, and the our bone or joint will get deviated sideways, that is what is known as the buckling. And due to this buckling, our bone or joint will undergo some failure. Okay, so this is also important to consider as the criteria of fracture or failure, because whenever buckling happens, there might be some failure in our muscular or bony compartments. Okay, so next is impact. So what impact? Impact means collision, the collisive activity between two bodies or two structures. So mostly we see impact injuries to our bones or other structures when there are road traffic accidents. So when we suppose you are going by a scooter and you met an accident, so what will is your body parts will get collided. So your body parts will collide with the structure you are hit by, and also your body will get collide body will get collided by the floor on which you will fall. So that impact, that collision may lead to the injury. If the impact is not too high, it will cause some failure or microfracture of the bone. But if impact is too high, it may lead to multiple fractures of the body. Okay, clear for that now that how overload, buckling, and impact works. So now what is creep? Creep we have already studied that when we apply repetitive stresses, a point reaches when the bone gets fractured or ruptured because of prolonged loading. In this type of failure, the stress that is applied is constant and is very below from the failure stress, but still due to repetitive and prolonged loading, this creep strain causes failure of the structures or fracture of the bone. Okay. So next, fatigue. We all know that when we apply load repetitively, ultimately at a point our structure will get fatigued. Okay. In this also, like grief, our stress will be very much below from the failure threshold, but still our bone can get fractured or get some kind of failure because of cyclic loading. That is, the load is applied repetitively. Okay, load is applied repetitively in a cyclic manner. So when we apply load repetitively, so how failure mechanism occurs? The first of all, when the fatigue starts, the initiation of fatigue happens. Okay, at that time there will be mild deformation only. There will be no visible changes though. So when fatigue initiation occurs, then the structure goes in micro failure, you can say. Then that failure propagates because we are not removing load at this point. We are continuing our repetition of loads after reaching the fatigue. So when the fatigue has initiated, it will propagate and ultimately will lead to the fracture due to cyclic loading of the bone. So I have, as I have discussed in my previous session too, that we should not fatigue our body. Though exercising is very necessary for our body, but we should not over exercise, over fatigue our body. Okay, or we can say that excess of everything is bad. Similarly, excess of exercise can lead to fatigue, and over fatigue can lead to failure or fracture of the bone. That's why we should not fatigue our structures. Okay, so these are the 5 main fracture criteria. The last one is wear. So this mainly occurs when there is some underlying pathology, or we can say that when we are dealing with the old age people. So because of old age, the bones have less mineralization, they have less strength than normal bones. So the bone gets wear off easily, means erosion, like in osteoarthritis. Okay, so in osteoarthritis of the knee, the both bones of knee joint gets wear and tear. That leads to the failure of bone, not fracture of the bone ultimately, but it can lead to the failure of the bone. Okay, so moving on to the next slide. Clear with these 6 mechanisms: fatigue, wear, creep, and impact, and buckling, and overload. Okay, so I hope these failure criteria are very clear to you. So now in this picture I have shown monotonic loading and fatigue loading. So what happens when we fatigue load a bone instead of monotonic loading? Okay, so when monotonic loading occurs, when occurs monotonic loading, it occurs when we fall, or when some blunt trauma occurs to our bone. Okay, and load level, single load applied to the failure. Okay, monotonic, as it is clear from the name, is mono, that means single load is applied, which can lead to the failure of the bone. So force applied over time is singular and is very static. Force that is applied is very static and is reaching its failure point quite after very much high stress. Okay, is stress strain curve is similar to that of a normal load deformation curve, and its failure mode is failure when material is loaded to ultimate stress. Okay, so when we monotonically we apply single load to our bone, the bone will not get fail or will not get fractured if the load applied is well under the ultimate stress. Okay, it will only get fail if the ultimate stress point is reached. Okay, but in fatigue loading we are not applying any excessive load to our body. It is just our activities of daily living that may include running, walking, running, jumping. In these kind of loading we apply repetitive loads, and that can lead to that can lead to the failure or fracture of the bone well below the threshold, well below the ultimate stress point. Okay, this is because the repetitive loads, or we can say that repetitive sub-failure loads are applied. So when we apply, we load, then unload, then we apply load, then we unload. So these kind of hysterical loops that will be showing the stress and strain going in fatigue loading. So in fatigue loading, basically we can't graph it as straight stress strain curve. We often see it as hysterical loops that shows the loading and unloading of the bone repetitively. So when we apply, as we can say that we don't apply consciously, but activities of daily living like running and jumping can lead to fatigue loading because they are repetitive in nature. Okay, so these stresses are although well below the threshold failure point, but can cause cracks in the bone, and cracks, that is the micro damage, start from the very beginning of the cycle until a critical level is reached. ठीक है, तो जब हम फटीग जैसे फटीग इनिशिएशन हो गया ना, तब से ही हमारे जो क्रैक्स है वो फॉर्म होने स्टार्ट हो जाएंगे बोन में, माइक्रो डैमेज स्टार्ट हो जाएगा बोन का, और टिल इट रीचेज अल्टीमेट पॉइंट, और जब एक क्रिटिकल लेवल पे वो साइकिल रीच कर गया उसके बाद आर बोन विल गो इनटू कंप्लीट फेलियर. ओके, सो दिस इज हाउ फटीग लोडिंग वर्क्स in comparison to simple or monotonic loading we observe. So fatigue loading is not what we apply consciously though, but still activities of daily living that we do repetitively can lead to micro damage or even failure of the bone. That's why I always say that don't stress your body, keep your body fit, but don't over exercise it. Never exercise your body if your body demands rest. Okay, so this is all about the monotonic and fatigue loading. So I have already explained this mechanism of fatigue failure, how crack initiation occurs, then crack propagation occurs, and then final failure causing the bone to fracture. Okay, so this is just a simple slide. Okay, so we all know that even the bone is normal, it will reach its failure point if the load is applied is too high, or if the load is applied repetitively as in fatigue loading. But what if the bone is already deconditioned, if we already have some disease condition of the bone, then what will be the load deformation curve of that, or how that affect our bone strength. Okay, So here are the three lines showing the bone deformation curve in the case of osteopetrosis, normal and rickets disease. Okay, so when we see the osteoporosis bone, its elasticity is reduced, bone strength is reduced. That means it cannot withstand higher loads as compared to the normal bone. Suppose if we can withstand 10 kgs of load, then if other person is osteoporosis, he may not withstand his bones will not withstand 10 kgs weight, he might withstand 5 to 7 kgs. Okay, so in this case the bone is behaving similarly, going into elastic deformation and plastic deformation and then getting into failure. But with very much less load. Okay, so if compared to normal, osteopetrosis patient can have fracture or bone failure even with the less magnitude of load, as even with the less we can say the lower magnitude of load as compared to normal, but they will withstand the load well before getting failure or getting into failure or fracture. Okay, and if the rickets disease is concerned, we can see that the bone can withstand more load, more magnitude, but will not show much deformation. It will show the property of brittle material. It will withstand. It will deform elastically with much load than the normal, but will get to failure or get fractured very easily without getting much deformed before the fracture. Okay, so this is about the two conditions I have already taken, but ultimately if we have some body disease, it will always lead to some variations from the normal. Okay, so moving on to the next slide. Okay, so now we have done with our today's session. So now is our summary. Okay, so very low loads, well below the threshold for physical damage, may increase the bone density. Okay, so we have already discussed that the bone remodeling process by osteoclast and osteoblast usually occurs before. So when the loads apply are well below the threshold levels of damage, they can help increase our bone density. Okay. Second is chronic may involve repetitive or strained loads while the tissue is still in a deformed state. Recovery time, not load size, may be decreased very soon. So in chronic cases of bone sustain, the tissue is still deformed. Okay? The tissue अपने भी अपनी deformed state में है because of repetitive and sustained load like creep and fatigue failure. Okay, so in these cases recovery time may be the critical variable, not the load time, because when we apply creep we don't increase the load, but the time is the variable. So we can say that recovery time plays as the critical variable in cases of chronic repetitive or sustained non-tissue damage. Okay, increased loads led to denser bone and increased incidence of collagen bone. This is very much true that when we apply loads, okay, when load is increased on the bone, it will lead to the denser bone because of increase in synthesis of collagen and bone. Okay, and if the decreased load, when the load is decreased, while increase in bone formation. Okay, so when we apply, say we take it as when we apply load, it will do more mineralization, make our bone denser, and will lead to more synthesis of collagen and bone. While we remove the load or decrease the load, we'll find out that there will be decreased bone formation and decreased collagen synthesis, but there will be increase in the bone resorption. Okay, so this is all about today's session: how bone behaves under load, what are the clinical things we can come across, or what the clinically we can use out of this bone load behavior, and how the bone gets fractured or how bone gets failed. So, summing up my session with this, thank you so much.